Nancy Roach was used to having hip trouble. The cartilage in her hip had worn away. Cartilage keeps bones at the joints from rubbing together. Walking long distances had become very painful for Nancy.
My right hip had bone on bone for 10 years.
Roach, who lives in Raleigh, North Carolina, read about a procedure performed in Columbia by Dr. Thomas Gross. It's called hip resurfacing. Instead of replacing the entire hip, Gross is using a method replacing only the cartilage. He uses metal caps to rebuild the hip.
You're trying to do the same thing, just replace the cartilage layer, but you're removing a lot more bone. And this had to be done initially because the initial resurfacings didn't work. The materials weren't tough enough to just replace a thin layer. So you had to go to all this extent, and then we've kind of worked on this and perfected this and perfected this. And a hip replacement, is a very good operation. But you do remove a lot more bone, and you have typically a smaller ball in, and the bone attaches to that. The bone grows into that over time. And on the femoral side, the ball side, you also do the same thing. You trim a little bone off. You make a little hole for a tiny peg.
Dr. Gross says hip resurfacing reduces complications from a whole hip replacement.
It's mainly the stability. If you make the ball smaller, it'll dislocate, so you have certain restrictions you can't do, or if by chance you bend it too far by accident, it pops out of joint. You have a dislocation, and you have to go to the emergency room and have it put in again.
Aside from using a cane, Roach was back to normal when we saw her at her 6-week follow-up. But Gross says not all doctors are on board with hip resurfacing. Dr. Gross says his colleagues often debate just who are the prime candidates.
There are many surgeons who say resurfacing shouldn't be done on anybody.
Gross says the latest numbers he's seen show a 98% success rate after the first resurfacings were done in the U.S.
There are controversies about who does the best. Certainly the group of patients that has done the best with the lowest complication rate has been the young male athlete.
For the 59-year-old Nancy, who is already back on her feet 6 weeks post-operation, hip resurfacing is just a walk in the park. Drew Stewart, Watch Fox News.